I want to first thank the medical examiner's office for putting this together. We were able to go on a tour, and which was absolutely fascinating, and just came up with this idea sort of organically as we were there, that there are so many changes that have occurred over the last several years when it comes to dealing with death certificates and so forth, that we just felt it was time for an update. And also Dr. Amaro is amazing, so I'm sure you will be impressed with the conversation today. I'm just going to give you a brief bio on her. Dr. Deidre Amaro is the Chief Medical Examiner for the Utah Office of Medical Examiner. She is a quadruple board certified physician with a keen interest in the public health aspect of forensic pathology. Having practiced forensic pathology in a wide variety of systems, she has an appreciation for the challenges and complexities of the current landscape of medical legal death investigation and aspires to shed light on how the majority of work that we do in death is actually for the living, in the hopes that more resources, training, and education can be provided to medical legal death investigator professionals, no matter the jurisdiction. So without further ado, we will turn it over to Dr. Amaro. Thank
I'm
you.
gonna leave some hair ties for the girls. I don't know.
Hello, Zoomland. So thank you for the introduction and thank you so much for the opportunity to talk to you today. I still much prefer in-person conferences, presentations. So I will do my best with Zoom. And if anyone is brave enough in Zoomland to give me your face, I very much appreciate having some sort of person interaction as much as possible. Thank you. Yes. So if at any point you have questions, please, feel free to raise your hand virtually, put them in the chat. I do want this to be a dialogue because I believe we are partners serving our community. Okay, so since you are going to get CME credit for this, the learning objectives are you'll be able to differentiate cause versus manner of death. You'll be able to identify types of death that fall under our jurisdiction, which is not all deaths. You'll be able to recognize the broader implications of death certification for public health and recognize us, the OME, as a consultative resource.
How's it going?
Okay, so in case anyone is curious where I came from, so a few years ago, I graduated medical school in Jefferson Medical College in Philly. I did my general pathology residency training in UC San Diego. Then I did a forensic pathology fellowship training in New Mexico, followed by a second fellowship training in neuropathology. And I had my first big girl job in far northern rural California, where I was the sole practitioner, the sole forensic pathologist for the Shasta County Sheriff-Coroner's Office, which was a vast departure from academia and a great learning experience. So after about 5 years there, I decided, maybe I do miss academia. And I went to Missouri, University of Missouri in Columbia, where I was one of the medical examiners. And then I came here about a year ago. So back when I first started, my first big girl job, back when I was new in this field, I thought, those big headline cases, I bet that'd be really interesting and fascinating. However, I quickly learned that big news headlines do not generally contribute positively to job satisfaction. But these were some of the interesting cases I experienced in Shasta County. Shasta County was also kind of famous for having, well, all of California's, wildfires, especially Northern California. But there was a summer in Shasta County where not only did we have wildfires, but we had a wildfire that turned into a tornado, which is the stuff of nightmares. But anyways, so let's talk about cause of death versus manner of death. This is a very basic distinction, but it gets conflated all the time. So cause of death simply refers to the injury or disease process that made someone dead then. And there's no absolutely one right way to phrase a cause of death. You can phrase it any number of infinite ways. It could be gunshot wound of head. It could be devastating central nervous system neurologic injury due to gunshot wound of head. It could be glioblastoma. It could be metastatic colon cancer. It could be exsanguination due to stab wound of abdomen, et cetera, et cetera. Manner of death, however, is multiple choice. So with manner of death, our options are natural, accident, homicide, suicide, or undetermined. And you as primary care physicians should really only be dealing with the manner of death, natural deaths. All of the manner of death accident, manner of death homicide, manner of death suicide, and manner of death we can't tell undetermined, those are my jurisdiction, along with many natural deaths. But you should never, except in very rare cases, which we won't go into, but you should not be signing a death certificate if there is anything non-natural that you think caused or contributed to their death, which includes traumatic falls, which includes subdural hematomas usually, because usually someone fell and that's why they got it. Okay, so in Utah, the Office of the Medical Examiner was actually established in 1972. It is currently within the division of the Utah Department of Health and Human Services. Every death within our jurisdiction, and again, not everyone who dies in Utah falls under our jurisdiction, but the deaths that do fall under our jurisdiction, we handle with the utmost care and professionalism. And we are always striving to provide the highest standard of investigation and care for all of our allied agencies, including the families. So this is the Utah Department of Health and Human Services, how it's structured. We are part of the Clinical Services Division, which is led by Executive Medical Director, Dr. Stacy Banks. Some of you might know her. She is a family practice physician. And so we are under her guidance along with Correctional Health Services. But we are, as you can see, this is a fairly massive organization. So what deaths do fall under our jurisdiction? The deaths that fall under our jurisdiction, this is defined by a very specific Utah code, 26B-8-205, if anyone wants to look that up. But the OMA provides statutorily mandated investigation of deaths in Utah that fall under these, generally speaking, these criteria. So sudden or unexpected deaths. This refers to where someone doesn't have any documented potentially lethal natural disease and they suddenly die. This is not the person in heart failure with lower extremity edema who is under the care of a physician and suddenly dies. We know that heart failure is not an indicator of health. There are some serious health issues there. Deaths that fall under our jurisdiction include unattended deaths. This does not mean everyone who dies at home. This means people who die at home and they have not been under the care of a healthcare provider. Deaths by violence, suicide, gunshot, or accident. I think that's fairly obvious. Deaths in custody or resulting from police actions. We play an important quality control role here to try to make sure that policies and procedures are followed. Deaths in the workplace, baby deaths, deaths from poisoning or overdose of drugs, deaths from threats to public health, and then deaths from suspicious or unusual circumstances. And most of these is determined at the scene whether or not it falls under our jurisdiction based on things that are at the scene, based on information gathered at the scene. So this is a map from the CDC depicting the different medical legal death investigation systems in our country. And when I refer to medical legal death investigation system, I'm talking about medical examiner or coroner offices, offices that are tasked with investigating and determining cause and manner of death for deaths that are statutorily determined. And while there's variation in the different statutes, they're all generally the same. So if you look at this map, you can see that Utah is this nice, pretty shade of blue, indicating that this is a statewide medical examiner system. There aren't many states in the country that are statewide medical examiner systems. It's Utah, New Mexico, Alaska, and then many of the states in the New England area where they're kind of, smaller geographic regions. So having a statewide medical examiner system means that all deaths in Utah that fall under our jurisdiction, they come to us, our office in Taylorsville, so that we can take care of them there. Most of the jurisdictions in our country are county-based jurisdictions, and most of them are coroner. So where I've worked in Shasta County here in California, here's looking at California based on county based on jurisdiction. There are 58 different counties in California and about 58 different ways of doing things when it comes to medical legal death investigation. This article is a little bit outdated, but generally, most of the jurisdictions in California are sheriff-coroner jurisdictions, which means that the sheriff, which is the highest elected law enforcement position, is also the coroner responsible for determining cause and manner of death. Last time I checked, sheriffs have no medical training. The counties depicted in blue here are coroner standalone jurisdictions, where again, it's the coroner who is tasked with determining cause and manner of death, but the coroner is again a political position with no medical knowledge training. And then there are a few counties where it's a medical examiner jurisdiction, they're forensic pathologists. So having a coroner or a sheriff-coroner jurisdiction is not necessarily a terrible thing, because sometimes they have the appropriate resources and they know their boundaries of knowledge, and they are able to hire forensic pathologists to do the actual determinations. But where I worked in Missouri, different state, that's Missouri in case y'all were wondering. So there are 100 plus counties in Missouri. And in Missouri, there are no sheriff-coroner counties, but they're all coroner or medical examiner jurisdictions. And the only determination of whether it's a coroner jurisdiction or medical examiner jurisdiction is population. So once the county reaches a certain population level, it gets bumped up to a medical examiner jurisdiction. But that doesn't mean they have the resources to actually have a medical examiner. So for example, I'm sure most of you remember from elementary school that the capital of Missouri is Jefferson City. But that is in Cole County. And so by population level, it's a medical examiner jurisdiction. But in actuality, their medical examiner is a cardiothoracic surgeon. And I'm not knocking cardiothoracic surgeons, but he has no training in autopsies, no inclination to do death investigation. And he would send all of his autopsies that he deemed worthwhile to us in Boone County, where we had forensic pathologists to do that sort of work. The vast majority of counties in Missouri, like I said, are coroner jurisdictions. And most of the time, the coroners are also the funeral home directors. And I'm not knocking funeral home directors. They're already in the death business. So most of the ones, at least that I interacted with, they were doing this as a service because nobody else wanted to do it. And last time I checked, the average pay for doing coroner's job in Missouri was about $13,000 a year, which even Missouri isn't enough to live on. So we are very fortunate here in Utah to have a statewide medical examiner system where our office is staffed not only with board certified forensic pathologists, but also death investigators who are certified by the American Board of Medical Legal Death Investigation, and a whole host of additional staff, highly trained, highly skilled staff that I think I'll touch on later. So our office in 2023, and yes, I realize it's 2025, but it's been a bit of a time. In 2023, our office investigated almost 8,000 deaths across the entire state. Our office signed over 6,000 death certificates. Our office did over 3,000 postmortem examinations. And a postmortem examination could just be looking at someone from the outside and not doing any incisions, to doing a full-blown autopsy. And our office investigated over 2,000 scenes. So if we look at the kinds of cases that our office handled in 2023 based on manner of death, remember, manner of death is multiple choice. Y'all should only be concerned about the manner of death naturals. This is how it was broken down. Most people, even physicians, even lawyers, even cops, tend to assume that most of our work is made up of manner of death homicide. So that's what's on all the TV shows, right? But in our office, and this is true across the country, no matter how big or crazy the jurisdiction is, even in Shasta County, this was kind of the division of cases based on manner of death. Most of the cases we're encountering, most of the patients we are taking care of, their manner of death natural or manner of death accident. And then sadly, In Utah, we have a lot of manner of death suicides. So the manner of death naturals that we see, this is mostly the middle-aged to older patient who maybe has never gone to see a doctor or hasn't gone to see a doctor in years and then dies suddenly at home. And it becomes our responsibility to figure out why they're dead and to fill out their death certificate. This can also be the young athlete who suddenly collapses on the field from a previously undiagnosed heart condition. And as you know, a lot of times, those kinds of heart conditions have genetic underlyings. And so we can, in these cases, do postmortem genetic testing, which can then inform the surviving family members of what mutation they might be carrying in this regard. And then hopefully that gets them to see the right cardiologists to get the appropriate screening so that they don't also end up on our table. The manner of death accident, these are mostly drug overdose deaths because we do have a drug problem in this country and in Utah. These are the vehicle accidents. And then a lot of these are the sort of hold my beer, watch this, stupid things people do. And homicide, manner of death homicide is of course important. We are a criminal justice entity, so we as forensic pathologists, we do have to testify in court. We do have to deal with lawyers. Bleh, not my favorite, but that's part of the job. However, I would argue that more than a criminal justice entity, we are a public health entity because we are literally seeing the terminal results of public health problems, right? Things that are killing people in our communities, we see that. So this is an article I love to reference whenever I talk about this, and it's from 2017, Academic Forensic Pathology, talking about the public health impact, how medical legal death investigation data help the living, right? So one of the quotes from the article is that in aggregate, death certificates tell a larger story about the health of our communities and the nation as a whole. And often the medical examiner coroner's office is the first to see trends in what's killing people in our communities. For example, in 1979, this woman, Susan Baker, she was an autopsy tech. So she was in the back where we do autopsies. She was helping with the very physically demanding job of doing an autopsy. And she noted that when there were car crashes involving families, babies, the infants were dying at much higher rates than older children. She thought, is this a real thing? Or is this, just some perception bias here? What's going on? So she was able to query death certificate data from the National Center for Health Statistics and discovered that that was a true trend. When families were involved in death and car crashes, infants were dying at much higher rates. Why was that? Ooh, I'm gonna get participation, yes.
Could be the forward seats, car seats facing forward, too early?
Yeah, well, it was even before we had any car seats. So back then, yeah, so you're so close. Thank you so much for for participating.
Was it?
Yeah, so back then, sorry, go ahead.
Was it because babies were being held in mom's arms?
Yeah, exactly. Back then, seems so long ago, but not really. We thought collectively that baby was safest in mommy's arms, but we know that that's not true. And we know that that's not true because of data that comes from the medical examiner coroner's office. And so because this true trend was noted, we got car seat laws enacted. So this kind of thing gets me really excited because, as you know, this is one way that we are positively impacting the living. We're able to see these trends, which then can help inform public health interventions like car seats. And then also my office can help monitor, are those specific public health interventions, are they working? And when it comes to car seats and baby deaths, that is working. We are having so fewer babies die in car crashes because of that. And I think that's wonderful. So, okay. So this is a blank death certificate that I got off the interwebs. It's actually from Iowa, but they're all pretty much the same. There's demographic information about the decedent, where they died, the method of disposition, are they being cremated, buried, whatnot, and then the cause of death, right? So there's the part 1 cause of death, and then there's the part 2 significant contributing conditions. But how do we get from this to things like this, right? Any data you see about leading causes of death for people in our community, in our state, in our nation, it comes from death certificate data. So this is a slide that was actually prepared for me by my friends at Vital Records in Shasta County. And since they're the ones actually dealing with this side of the process, I trust completely that this is accurate, and I just keep using it over and over. This is specific for California, or the initials are about California Department of Public Health, but extends to every state. So we have a death of a patient, and the coroner or physician certifies the death, signs the death certificate with the cause and manner of death. And again, y'all should only be concerned with manner of death natural. The death certificate is registered then by the local jurisdiction, the local health department, and submitted to the state health department, where it is preliminarily coded at the state level and then sent to the National Center for Health Statistics. At the National Center for Health Statistics, highly trained nosologists, coders, assign ICD-10 codes to these causes of death. Like every medical diagnosis, a cause of death determination gets an ICD-10 code. And then that information is sent back to the state health department and then disseminated to the individual local health departments, where they can extract whatever information they want and publish those, this is the leading cause of death in our area, publications and whatnot. So to oversimplify what happens, right? So we have our DC, our death certificate, which we fill out, which you fill out. That death certificate gets turned into mortality data, which is housed within the CDC. And then that mortality data is used by all sorts of different entities to help design public health strategies, help decide resource allocation, and to drive research, all with the goal of ultimately improving health. But as we all know, right, if your garbage going into a data set, or if your data going into a data set is garbage, it's going to be garbage coming out. And so this, when I think about the mishmash, hodgepodge medical legal death investigation systems in our country, like it really makes me upset and queasy almost, because how can we get quality death certificate data by people who don't have any medical training, right? And so I mentioned that different jurisdictions have different standards and different ways of doing things. When I was looking into this years ago, for example, there's a jurisdiction within Georgia where the only requirements to be a coroner and therefore determine cause and manner of death is that you have to be 18, you have to have a GED, and you have to have undergone 2 weeks of training. That blows my mind. So I suspect that many of you as primary care physicians, as family docs, part of the reason you're in this field is because you like treating the whole patient. And you get to see everyone from baby to granny. So in many respects, we're not that different. So I don't get to see a single patient over their entire lifespan, but I get to see a single patient and incorporate their medical history, their social history, their physical exam findings, their toxicology. Look at all of that. It's like a snapshot in their time to try to determine cause and manner of death. And my patient population, similar to yours, can run from a fetus whose mother, who underwent intrauterine fetal demise because mother was abused or took illicit substances, to a 100-plus-year-old granny who fell and broke her hip, and everyone in between. So no matter how old, how young, what they look like, the color of their skin, their political affiliation, their religious affiliation, their orientation, no matter what they look like, if their death falls under our jurisdiction, they come to us and we take care of them. No matter how poor or rich, if the death falls under our jurisdiction, they come to us and we take care of them. And we do not work with health insurance companies. We do not bill for our time. And I think that's pretty cool. I don't suppose, does anyone like to watch the CSI TV shows? This is NCIS. So I do enjoy these TV shows. They're absolutely ridiculous, but they are kind of fun. So in NCIS, Ducky is the forensic pathologist. And I forget Mark Harmon's character's name, but he's lead investigator. And so most of these TV shows portray maybe a forensic pathologist who's able to do a Y incision, look at the heart and say, oh, this person was clearly murdered by arsenic on June 12th at 3:07 p.m. by his wife, which is total BS, as we know. And usually maybe one or two investigators. But really, it takes so much more than that to come up with a reasonable cause and manner of death. And so at our office, which is pretty unique, not just because we're a statewide medical examiner system, but for other reasons, it's an entire team. So we have our front office staff. They're the ones who are often the first to interact with grieving families and try to help them on this, try to help them navigate this really scary process of now my loved one is dead. What do I do next? We have our administrative and fiscal people who, help with those very important things and make sure we are being as efficient as possible with our limited funds. We have our morgue clerks so our office is staffed 24/7, but we are not doing any exams on Sundays, but we always have a morgue clerk who's available to accept and release bodies. We have our autopsy assistants who are the ones in the back with the forensic pathologist helping with that very, it is manual labor. It is physically demanding, the job of doing an autopsy. We have our forensic pathologists. Like I said, we're all board certified forensic pathologists. We are specifically trained in doing this kind of death work. We have our death investigators. Our death investigators are, I think of them as kind of the eyes and ears of the forensic pathologist. The scene is so important. The scene provides us with that snapshot of how someone lived. How someone lives is so often related to how someone dies. And they are also the ones who are most frequently interacting with the families in that acutely grieving space, which is very emotionally charged. And the other really amazing, another really cool thing about this office is that we have a group of epidemiologists on site who are helping us understand the why of death. So just briefly about them. So our epidemiologist at the OME here in Utah, this is a very unique setup. I don't know of any other medical examiner coroner's office in the nation that has such a dedicated team of epidemiologists posted in the medical examiner's office. They specifically focus on suicide and drug overdose deaths. And because of their work, we're able to have more real-time surveillance of drug overdose deaths. And when we detect clusters or potential clusters of drug overdose deaths, we're able to reach out to our partners in the community and try to get responses in place to prevent future deaths. They also do these next of kin interviews. So when someone loses somebody to suicide or drug overdose, someone from the epidemiology team will reach out to them months later to check in on them, because we know that so often if you lose someone to suicide, you're at a higher risk of dying by suicide yourself. So these next of kin interviews are to check in on the survivor and try to get additional contextual information surrounding their loved one's death. Because if we can understand why someone overdoses or why someone dies by suicide, that gets us closer to preventing another one. Yes, so we're big on postvention because we believe postvention is prevention, just like we talked about. One of the other really cool things we do is we're sort of a repository of resources, so we're able to get people hooked up with a variety of different resources that already exist in the community, all with the motivation of being so that they too don't also die. So I always speak faster than I think I will. So that's talking about cause of death versus manner of death, what kinds of death fall under our jurisdiction. I think I was able to convey how the death certificate data has much bigger public health implications than just, why did this one person die, and provide closure to their family. So now I'd like to present to you the idea of the OME of us here at the medical examiner's office being your consultants, right? So when you have a patient who has complicated heart problems, right? I imagine you have no problem sending them for a cardiology consult. When you have a patient who has complicated psychiatric problems, I imagine that you have no problem sending your patient for a psych consult. Or complicated lung problems, a pulmonology consult. If your patient develops a death problem, please feel free to reach out to us. I know that probably none of you were trained in how to sign a death certificate during med school. I wasn't. I doubt you got really any training in residency. I didn't. I only got training in how to do a death certificate in my forensic pathology fellowship training. I imagine for most of you, it was maybe your first day, but during intern year, one of your patient dies and the maybe medical record sends you the form to fill out and they're like, what's the cause of death? And you say, I don't know how to do this, but you fumble your way through it. It doesn't have to be like that, right? This is our specialty. Let us help you. One of the problems that our office, and not just our office, but most offices around the country encounter is, so if we decide that a death isn't under our jurisdiction, it's your responsibility as your patient's physician to provide that final act of care, right? To sign that death certificate, which is important for the family, for your patient, and for the broader public health understanding. But not uncommonly, our office and many other offices encounter situations where we've determined it's not our jurisdiction, but the primary care physician refuses to sign and refuses to sign and refuses to sign. And I get it to a certain extent because you don't know, and it can be scary, and you weren't trained in how to do this, but your refusal to take care of your patient in this last way makes the family suffer, right? The family needs to have that death certificate signed so they can move forward with the grieving process, so they can have a burial or a cremation or get the life insurance paid out, get those other kind of boring but really important financial things taken care of. So what not uncommonly happens in these cases is, because we know that the family is hurting, we will then step in, even though not our jurisdiction. We will request the medical records from your office, read the notes that you wrote about your patient, and then we'll come up with a cause of death based on your notes, your examination for your patient. That gets a little bit frustrating. So how this usually goes, right, is somebody dies at home. Cops are usually the first to encounter or outside of family, cops are usually the first to encounter the dead person at home. When cops go, they are trained, they're attuned to looking and seeing, is there anything suspicious here? Does it look like this person was murdered? Does it look like there's trauma? Does it look like a drug overdose? Is there drug paraphernalia? So they look for those things and they will call our office and usually get one of our investigators. And our investigators will lead them through a series of additional questions to try to figure out, is this our jurisdiction or not? If there's any suspicion of trauma, like they fell and hit their head and there's blood, it's our jurisdiction. We're not going to ask you to sign. If there's any suspicion of drug overdose, either because the prescription medications are not the number they should be, or there's drug paraphernalia, that is our jurisdiction. We assume control. We're not going to ask you to sign. But if at the scene, the cops don't think there's anything suspicious, our investigators didn't get anything suspicious over the phone, and we release jurisdiction, then it becomes your responsibility to take care of your patient in this final way. If, however, you have other information that, for example, you know that your patient has a history of overtaking their opiate medications, or you know your patient has a history of illicit drug abuse, then communicate that to us, reach out to us and give us that additional information. Yes, so I feel like we really need to have a partnership in this regard, because we're taking care of the same populations, right? We are serving the patients of Utah. So let us work together. And if we can help you, we are happy to help you. I am always happy to answer questions and help you do your job, but I don't want to do your job for you. This is our website. I think it's a fairly good explanatory website. You can see that there is a specific button for physicians. So if you have any additional information, you can look there. It doesn't have all the information, but I think it has a good basic summary of the basic information, and it has our phone number. So if you have questions or concerns, please reach out to us. Let us help you. So this is a quote from the Dalai Lama, right? So death is a part of all of our lives. Whether we like it or not, it is bound to happen. Instead of avoiding thinking about it, it is better to understand its meaning, right? So everybody dies. It is inevitable. And we have, as a society, have created this really kind of fear-based approach to it, I would say, because we like to pretend it doesn't happen. It does happen. And so I think about all these poor families who lose a loved one, and there's the trauma of that loss, right? That's real trauma. And then there's an additional layer of trauma, because then they have to suddenly try to figure out this whole system and navigate all these hurdles that they never thought they'd ever have to. And one of our goals here at the Utah OME is to minimize that additional trauma, right? We're not going to minimize the trauma of losing a loved one, but that additional trauma of what do I do next? How do I get a death certificate? Oh my God, what do I do? What do I do? We can collectively minimize that. And that's one of our goals. So I always talk way faster than I thought I would, but plenty of time for questions. So if anyone has questions, please let me know.
I'll start off with a question.
Yes.
So I guess looking for guidance on how to fill out a death certificate. I've
Yes.
only had to fill out one so far in my career, and that was as a resident. And it was a patient who was found dead in his apartment by a neighbor. Just hadn't seen him out in a few days, where he usually sits out on the porch. Had a wellness check drawn, and he was dead in his house, basically. Determined no foul play, came to me. And I guess I don't actually remember how I filled this out. I think I just kind of fudged my way through. But when someone is just found dead, and he had some comorbidities, but it was sort of unclear what finally kind of got him in the end. Like how are we supposed to put that? Because I think on the death certificate itself, at the time, it said something to the effect of, like cardiac arrest is not an appropriate thing to put in here.
Yes,
so
no,
I guess
great
what would
question.
be best practice in that situation?
Yes. So one, saying cardiac arrest or cold cardiopulmonary arrest, and that's it, doesn't tell us anything other than you died, right? So it helps me to think about the death certificate from the standpoint of a data point for what are the significant health conditions in our patients and in our community. So often we will not know the actual mechanism of death, even with autopsy. I don't know if they had, a sudden embolic occlusion of one of their coronary arteries that happened to not be able to cut through closely enough, or did they have a fatal cardiac arrhythmia? I can't see arrhythmias at autopsy. So a lot of the times we're still guessing too. We just have more data to inform our guess. So depending on the comorbidities, if they have coronary artery disease, you could just say coronary artery disease due to atherosclerosis. You don't need to provide that final mechanism of death, because most of the time we can't tell. There's no way. And it doesn't matter it's more important to give the sort of the chronic disease condition that was significant.
So, obviously we don't also know how he actually died.
Right.
But it sounds like it's helpful to put like, oh, he had, he was a diabetic who, I don't know, also had COPD or like lung issues or something.
Right.
Okay.
So if those were the issues you knew about, diabetes, COPD, then you could just put complications of diabetes or complications of COPD, or just as long as you're putting the major potentially lethal health conditions on there.
Got it. And then can I ask another question? Unless someone
Yeah,
else.
please.
Okay, so when you hear these stories of skiers being found dead in tree wells at ski resorts, I guess what is the process that happens there? Is it because it's presumed to be like no foul play, right? Like they probably hit the tree or they, suffocated in the tree well, or like how do those usually go?
So those usually go where they're found dead. Our investigator goes to the scene and becomes our jurisdiction, because this doesn't look like a natural death. Like it doesn't look like they just had a heart attack and keeled over.
Right.
So drowning or hitting a tree, those would be non-natural things. And then it become our responsibility to do a postmortem exam to whatever extent to try to figure out what non-natural things might have played a role.
Thanks.
Dr. Marl, I have a couple questions.
Yes.
Sometimes I struggle with like whose responsibility. So I wear a couple different hats. I work in a clinic and take care of patients longitudinally, but then I also work in the ER. And I have patients who come in who have are coding when they come in. They're found dead, dead, and they're coding. They bring them in. And so I've had a couple of situations. I've had a situation where it's my primary care provider. I'm the primary care provider of the patient. They were found dead in their home. They called me and said, "Hey, can you sign a death certificate?" And I'm like, "Yeah, he had coronary artery disease. He had diabetes. Probably he died of a heart attack." And I'm able to put that down there as a possible cause.
Yep.
Then I had situations where the patient, I'm not their primary care provider, but they come into the emergency room coding on the ambulance, and then I have the investigators, the police that come in and say, "Hey, will you sign a death certificate?" I'm like, is that my responsibility as the ER doctor? I mean, I guess technically I was the last person who attended to the patient while they were alive. I mean, because I attended to them before I called their death. But
Right.
they technically were not alive, and I don't necessarily have. Where does that line draw? Like, do I sign it as an ER doctor? Do I say no, go talk to his primary care provider, or I don't know.
So generally speaking, we don't expect ER doctors to sign a death certificate.
Okay, good.
There are examples, sometimes where it's an obvious, car accident or something. We don't feel we need to bring them in, but most of the time we don't expect ER doctors to sign death certificates for those reasons exactly.
Okay.
And different states have different rules about that. And I think somewhere it might be expressly put that ER doctors do not have to sign death certificates, but I don't remember. Sorry. But if you're in that position of cops are asking you or telling you to do that, remember that death is our job.
Yeah.
So feel free to reach out to us for any clarification.
Okay. And can I ask you another question? So let's say that I decide so it's my primary care. I'm a primary care provider of a patient. They're my primary care, and the patient passes away at home, whatever. I get called and asked to sign a death certificate. If I don't sign it, what is the process there? Does that body have to come up to you guys to do a medical examination, or how does that work?
So if there's a death that occurs at a home and the medical examiner's office is notified about it, and we do the extent of investigation that we think is necessary, and we determine it's not our jurisdiction.
Okay.
So we release jurisdiction. Then it usually falls on the primary care physician. And usually what happens is the funeral home then gets tasked with trying to reach out to the primary care physician to get them to sign it. Or, oh, this patient also has an oncologist. Maybe I'll try the oncologist. So then they're in this kind of uncomfortable position, I imagine, of just desperately trying to find a doctor to sign a death certificate for this patient so the family can move on with the grieving process.
Exactly. 'Cause that
And
seems to
then,
be the situation is that the law enforcement are, saying, well, we got to get this patient to the coroner so the family can, move on and, will you please sign this? And, so there's a little bit more pressure there sometimes.
oh, well, if medical examiner's office is involved and they're bringing him to us, you should not be signing the death certificate, period.
Okay. Okay. Good deal.
Um, but we not uncommonly do get involved when funeral homes have reached out to the primary care physician, have reached out to the cardiologist, have reached out to the oncologist, and they're all refusing to sign.
Mm.
And then we want to help the family, but it's not our job, but we want to help the family and we want to maintain good working relationship with the funeral home. So then sometimes we will step in and take your medical records and use your diagnoses to provide a cause of death.
Yeah. Is it typical for, like, if a patient's found dead at home, is it typical for them to always reach out to you guys in those situations and then have you decide if it's not your part of your jurisdiction? Or because I feel like a lot of times, at least down in the rural, I live in Blanding, Utah, so we live down here in San Juan County, very rural. I don't know if they are reaching out to you guys every time that happens,
No.
because if they reached out to you and you said no, I think it's natural, have the primary care provider sign it off. I think I'd feel more comfortable with that than if they just come to me and say, hey, would you just sign this so we don't have to worry about the whole process of going through the medical examiner. Does that make sense?
Ooh, yeah, no, that does make sense. So, and this is an area I'm still trying to get a better grasp on what's actually happening. So this is very helpful. So in California, every residential home death had to be called into the coroner's office. My understanding here in Utah is that is best practice, but that is not always happening.
Yeah.
And it might not always be happening in the more rural areas.
Yeah.
So if you ever find yourself in a position where you're unsure if the medical examiner's office actually got involved or if it's just law enforcement being kind of pushy, call our office, please.
Okay, good to know. Yes, thank you. That's very helpful.
We would much rather learn about these deaths at the time of the death or shortly thereafter so that we can bring them in if necessary. Then what often happens is we find out about deaths that could be our jurisdiction on the back end, meaning when the death certificate has been signed in Eden and the folks monitoring the death certificate, vital records, they flag cases for us to review.
Yeah.
And so
I wasn't aware about the whole accident thing. Like, I didn't even think about that. Like, so somebody fell and got a subdural hemorrhage. I mean, if the cop would have come and said to me, well, he was, 70 years old and he tripped and he hit his head and he was on Coumadin and, he bled on his head. And I would have just been like, okay, yeah, that's a natural cause. And I would have just, signed it off.
I know. But this goes back to, we're not taught any of this in medical school or residency.
Yeah. So,
but
so now I know. Now with this training, I know that that was an accident. That should go to the medical examiner.
Yep.
Yeah. So okay.
Right.
But I think it'd be helpful if, like, and I'll try to pass it on to my local law enforcement down here, that if it's a death that happens at home, they should contact you guys first, and then if you guys determine that it's natural, then they could come back to me as the primary care provider, and I would be glad to help them in that case. So, but
thank you, Casey and Dr. McCullough. Dr. Amaro, real quick question from the chat. Can PAs and NPs sign the death certificate?
Oh, God. Every state has different rules. And I forget what it is in Utah, but I think in Utah, PAs can sign death certificates, but I don't remember specifically.
I think they have to have it co-signed by a physician.
Interesting.
I thought the law changed. Sorry, it's Chris. I'm pretty sure the law changed that they could.
Yeah, things have been changing pretty rapidly for advanced practice clinicians in Utah over the last couple of years. So it wouldn't surprise me if that changed. Somebody want to ask ChatGPT if they know?
Yeah. I'll ask.
In the chat, Catherine says she's an NP and she signs death certificates. So
thank you, Catherine. Okay, and Jan Clement says I have signed them as an NP. So yeah, again, the laws have changed, so that's good. Thank you for those who provided that clarification. I wanted to ask a couple of quick questions. Marianne and I were able to take a tour, and there were a couple of things that we discussed that I wondered might come up for our clinicians on the call. What do you do if a family is requesting or insisting on an autopsy when they don't actually qualify for one under all of the laws in Utah?
Right. So this happens on occasion. If a death does not fall under our jurisdiction as determined by our office, then we have no legal right to do anything with the dead body. If a family still wants an autopsy after we've probably done some re-review to make sure it doesn't fall under our jurisdiction, then they'd have to seek out a private autopsy. Some hospitals, but not every hospital, have hospital autopsy services. So if a patient dies in hospital, that could be an option. But for hospital autopsies, the next of kin has to sign the consent.
Good to know. And thank you, Dr. Bank, for clarifying that. Utah admin code, see, we don't need ChatGPT, states that a physician, physician assistant, certified midwife, or nurse practitioner will certify the cause of death as defined in law. So thank you for clarifying that.
There was another question up above the other question. It said, how do you find out who the deceased's PCP is?
So how do we find out who the decedent's PCP is? Usually from either prescription medication at the scene or interview with family members.
Thanks. That was my question. And my own healthcare system can't always identify who a patient's PCP is within their own system. And so I was just curious about how you guys did it.
Uh-oh. Our presenter may have frozen just in time. At least we're coming in close to the end. I think we lost her. That's unfortunate. We'll see if she comes back on here.
I'll pass
there she is.
I was going to pass on.
Okay,
Thank
sorry.
you.
So we find out the decedent's PCP from from the scene investigation. So prescription medications at the scene or from talking to family members usually.
Thanks.
The other question I had, I feel like we discussed this when we did a tour, was, is there a different case in requiring an autopsy if the family is requesting cremation?
No. Whether we do an autopsy has nothing to do with cremation. Okay. But if a family is requesting cremation, which usually would happen after an autopsy, if an autopsy was done, which happens after the DC is filled out usually, because of Utah law, every death certificate for a decedent who's going to be cremated or removed from the state, we, the ME's office, have to review that death certificate before the cremation or body removal permit is issued. And that is because, we want to have redundancy in system and make sure we don't miss a homicide or something else that should have come to our office but didn't for whatever reason.
Good to know. Any other questions before we wrap up today? I think I wanted to emphasize again, it sounds like occasionally some really complicated situations come up where lines are blurry. And I think that emphasizing the slide that you said, use the OME as your death consultant is important. And we really did have, I feel like, a wonderful tour. Is that something that anybody can request? Can any of these folks or anybody watching this later, if they really wanted to learn more and come for a tour, would they be able to do that?
Yeah. Not just anyone Joe Schmo off the street, but if you have a legitimate reason to come for a tour, we are always happy to share what we do. And I think, I would always feel more comfortable sending my patient to someone I knew. From that standpoint, you're welcome to come visit us. And we'd be happy to, give you some more names and faces to go together and give you a tour and a more in-depth look at what we do.